my research is really focused right at the intersection of chronic disease self-management and health disparities. Interestingly enough, the most resistance and pushback I get for the digital health approaches I take in the communities I work in are not from the participants and the patients that we work with. It's from my colleagues who wonder why we are trying to take digital health interventions into communities where digital health infrastructure or digital infrastructure may not be very good. I think we have to address it head on. We have to specifically focus on health disparities and think about how do our decisions impact the communities that we're trying to serve. Every decision could have multiple different angles that we, or approaches that we could take. And if we're not specifically focused and thinking about health equity at all turns, it's going to get lost in the shuffle. And it is something that is so important that we keep it front and center with everything that we do. If I could accomplish anything, it would be to better understand how to implement digital health solutions. Right now, we have this good understanding of, I think, what healthcare is going to look like in 20 years or 30 years or even 10 years. But the gap from how we get from where we are today to where we need to be in 10 or 15 years is very unclear. There is so much work that needs to be done with implementation and understanding how to approach change and clinical transformation, that we could have the best digital solutions that could completely fail if we don't have thoughtful approaches to implementation. So we really have to think differently about how we ask questions to assess whether somebody is satisfied with a program. And I think that's a really interesting and tricky problem to have to solve.